Dental Nachos. Good to see you guys. I'm proud to be here with an awesome SAD. What does SAD mean? SAD means seasoned-aged dentist. It's not a bad thing. It's a good thing. Seasoned-aged dentist. So even though Dr. Ann does not look it, she has been practicing for 30 years. I know some of you guys out there in Dental Nachos have not been alive for 30 years. So feel good about that, Dr. Ann. So before we
I have to be alive for 30 years. Come on.
Yeah, no, yeah.
Right?
Before we dig into you looking for an associate and what we'll talk about, what you're offering, which is awesome, I'd like to take a minute because I love meeting you face-to-face, just as I said on Facebook in Harrisburg. So in Harrisburg, we had a lecture on, my lecture was kind of on the circle of dentisting life, going from dental school to after dental school. So did I seem the same in person as you imagined from Facebook?
Oh, yeah. Exactly the same.
Thanks. That's a compliment. What was one of the things that stood out to you from the lecture? Whether if you maybe even you put yourself back in your young dentist shoes, what would be a takeaway you would have?
It's so different from when I was in those shoes. I came out of dental school and I bought a practice.
Yeah,
it just seems like they don't. I feel bad that they don't really have the opportunity to do that.
Yeah, it's a much different world with what they face with financial hurdles. In just, even from 10 years ago to 20 years ago, every 10 years, it just gets markedly different. And that's why I'm glad to be doing this and bringing them, a great dentist like you who has an associate looking for another associate, bring in these opportunities because this whole matchmaking world is tough. Like most people went back to their hometown, saw the dentist in their hometown. Now people will move and do things that they can find a good reason. So let's talk about I call myself sometimes Dr. Nacho, the dating coach, bringing dentists together. So Dr. Ann, take a few minutes. Tell us about your practice and where you are.
I am in Hellertown, Pennsylvania, which is a great location. It's about an hour and a half north of Center City.
Okay, that's not bad.
Yeah, no, not bad at all. You can be there in an hour if there isn't traffic.
Perfect.
And it's only about an hour and a half to hour 45 outside of Manhattan.
That's a great location. And we talked, I am a graduate of Villanova, two-time recent national champion in basketball. And at Villanova, back in my day, I'm a medium-age dentist, 41, so that stands for MAD, medium-age dentist. One of our favorite things to do was to go to the King of Prussia Mall. And you're only about 50 minutes from the King of Prussia Mall, right?
Yeah, it's great.
So what I encourage
I'm only like 50 minutes from the Short Hills Mall.
Yeah, right. Everywhere you can shop, eat, come to Center City. One of the things that I like to share awareness with dentists, and I have a few associates myself and broker practices and speak, is that, I totally understand the desire not to commute for a job, but I tell young dentists that with podcasts or music, you may as well commute to a job that you like than be at a job that you don't like 2 minutes away because dental hours, one thing that I think dentists have done a disservice to, and you probably would agree, and my dad was an awesome mentor, awesome dentist, but dentists would tell people they work 4 days a week, and that's just a lie because dental hours are like dog year hours. 30 hours working on patients is not 30 hours doing other work. And additionally, as a practice owner, there's a lot of behind the scenes work that goes into what we do.
Correct. Yes.
So as an associate, what I call the aunt or uncle of the practice, you go there, you're not responsible if the toilet breaks, you're not responsible for hiring and firing, which is great because you can focus on dentistry. So my message is no big deal commuting. I think that's a great location. Tell us a little bit about the history of your practice and what goes on there dentally and about the community.
Well, I bought the practice in 1989. I graduated in 88 and I worked 1 year as an associate. So I kind of knew from 1 year what it was like. I had a really bad experience. So I hope to be a much better boss to my associates. So the practice has been here since 1955.
Gotcha.
And I started when I bought it, it was 800 square feet. You came in the front door of the waiting room and you could see out the back door. It was crazy.
Wow.
Three rooms. There wasn't a hygienist. There wasn't a computer.
It's a real Doc Hollywood dentistry back then. You're doing everything.
It was like. So then I bought the duplex house next to the office, and I took it down in 2007, and now I have 8 ops. So
Puff Daddy, do you know the rapper Puff Daddy, who's
Yeah.
he's a national treasure. He acts, he sings, he raps. I mean, if you haven't seen Get Him to the Greek, I mean, he's magical in that movie. But he had a song, More Money, More Problems. Don't understand that totally, but I guess when you're at his level, maybe that happens. But I say in dentistry, more ops, less problems, because
Yes.
so much goes on as a general dentist. I have 2 offices, 1 5 operatory, 1 3 operatory. And the 3 operatory practice, it's just, you're working with like an out of safety net, you know, denture adjustment, broken tooth. You just need a chair. So I think 8 operatories is awesome. And for young dentists out there, I mean, if you're going to build a place or buy a practice, just the more dental rooms you can have, the better. And so tell us now, and one of my things, I do this webinar on Dr. Nacho, the dating coach. I tell young dentists what they should ask. And then I tell, you know, SADs and MADs what they should know the answer to. So the webinar could be for anyone. One of the best questions I start with is, you know, why are you looking for an associate? Tell us, you know, if I'm interviewing and say, hey, Dr. Ann, this is great. I'd love to be an hour away from the King of Prussia Mall near Manhattan. This part's perfect, but just share with me why you're looking for someone.
Well, because I want to stop working all these extra hours that I'm working. I'm working now 3 12-hour days.
Wow.
And tired. I want to go back to my schedule that I used to have when I had Tuesday afternoons off. And I'm working 5 6 days a week, and we got 300 new patients since January.
That's amazing growth. And as I share with the dental nachos community, sometimes when dentists say they're too busy, you gotta ask more questions. And we were talking, you know, 100 new patients a month, and you're sharing you have a desire and a need to cut back on your schedule, which will leave leftover dental work. You know, I eat like a lot of food. I talk about nachos. I also talk about pizza. And, you know, if you think of your office as this has all these pizza slices of production, you're sharing that you will share this production with an associate.
I need to work on my practice. And right now I don't have time to work on things that I have to get done because I'm tired.
One of the books we usually have up here is the E-Myth Revisited, and Working on and in Your Business by Michael Gerber is important. Okay, great. Now, dentists, they love specifics. So before we get into the money part, I want to get into the clinical part. Okay, I say, okay, doctor, and I'm going to work for you. What am I going to be doing with my full-time work? I know I'll be checking hygiene. What are some other things that your associates do to fill up their day?
Well, basically, they check hygiene, and whatever they bring out of hygiene, they can keep and work on. So they need to do fillings, crowns, and be great if they could do root canals, extractions. I mean, basically, root canals and extractions are the bread and butter of general dentistry because that's how you take care of the toothache. And
what's cool, and I've talked about this a lot in my rants and things, is that, you know, I've worked in the restaurant industry for 10 years as a server. And, you know, the real way to learn as a chef is, or even as a server, is to be with a bigger, stronger chef and say, hey, don't make it this way. Or even better, come watch me prepare this. And you place your own implants, right?
Yes, yes.
So, I mean, that's just awesome for a young dentist, even if they don't want to do that all the time themselves. They may not know. For them to be able to walk over to your operatory and in a, you know, just a game time situation, say, hey, can I watch you place an implant? That's just an experience that I want to impress upon young dentists is fantastic, because you don't often get times to do things like that. And then I'm sure you would support them if they wanted to place an implant.
I mean, it would be a great mentorship for any young dentist.
You know, I think and I'm glad you mentioned mentor. And mentor to me is a loaded word. Everyone likes mentor, and it's a good word, but kind of like that child's book, like where, you know, are you my mother? It's like, will you be my mentor, right? And people say that, and the person says yes. I say, okay, what now? You know, what does that mean? And we have young dentists in our office, and I think mentorship is basically them watching me operate and asking me questions behind the scenes. So they're seeing their patient, they say this overdenture on implants doesn't fit, and I say, show it to me outside the room. And I say, oh, there's a big undercut here, change these locator attachments, and then go back in the game and do it. So mentorship, I think people think, is some sitting knee to knee discussing the philosophy of occlusion.
No, that's just, you know, and helping with maybe even verbal skills or
totally,
how to deal with the patients.
I mean, I'm going to do a course coming up eventually where it says, patient says this, you say this. Team member says this, you say this, because that's valuable. Because a lot of times, especially young dentists, and they're awesome people, what they think they should say next based on their life experience can be off-putting to the patient, could be inflammatory. could be unfair to a team member. But, you know, there was a book like Men Are From Mars, Women Are From Venus with John Gray that was popular. It was a great, great title. It's
Yeah.
like, you know, young associates, you know,
I lost you.
as a resident, and they don't realize how much energy it takes to do that.
I lost you there for a minute.
Oh, sorry. I was saying what young dentists don't realize, I think, is seeing so many patients is a lot of mental energy that you have to extend.
It's a tremendous amount of mental energy.
And they think, oh, what's the big deal? I just do the extraction. I just do the crown prep. And then my dad actually told me this. It was such great advice. When I was going through dental school, I was like, I don't know if this is for me. And he said, doing dentistry will be the easy part one day. And it changed.
I always say that. Fixing the tooth is easy. It's everything else.
Yeah. So now let's talk about what dentists like to talk about, money. So we have these young dentists. They have loans. They want to, support themselves. What's a range? You know, they work for you full time as an employee, you're telling me.
Right.
First, I ask, which is, do they get a daily safety net guarantee?
Yes, $500.
Actually, so if they come, and I think that's important, young dentists to realize, and I think that shows an owner that's committed, that, and I'm very much the same way, $500 a day. And I've used the word safety net guarantee. I haven't used the most you could make. So then if they do more work, they'll be paid on collections. How are they paid that way?
32% of collections. And then also I subtract 32% of their lab bill.
Yeah, so I think that's a great system. So if dental students are watching or office managers, what that means is if you work 200 days a year for doctor, and you'll make base $100,000, 200 times 500, but you have the potential to make a lot more based on your collection. So that to me is a win-win. You have a base of production, and you were sharing with me, would you say making between $170,000 and $200,000 is a reasonable range for an associate?
Yeah, the sky's the limit. It's how hard they want to work and how much dentistry they can do. You know, I know they're slow to start, but some are a little bit faster than others, I guess.
And also one of the things I see, and I see it with my own associates, and just to manage expectations of owners and MADs and SADs, is that when someone comes into a practice, and they could have even been a dentist for 10 years, they don't know any of the patients. So every patient is a new patient to them. So I believe it takes a full 6 months of seeing them once. Then they get to know the person, do a little more, and that's why they can increase their revenue. But I think some things to think about Dental Nacho's world is Dr. Ann gets 100 new patients a month, wants to work less, is committed to a base guarantee with the potential to do more, will mentor you. Anything else you want to tell us about your job, working there, working with you, fun stuff? I think you said your team likes to laugh all day in technology. Tell us a little bit about that, the fun stuff.
Well, we have fun. We laugh. We have a pretty big staff. There's 16 of us. I do have 7 EFTAs.
Oh, wow, that's great.
You know, and they mentor the associates too, because they actually can do fillings better than, you know, my associates when they're first coming out of school.
Totally.
So, you know, they've done them for 20 some years. So of course they can.
One of the things dental school, I think, doesn't really show is that you get good at what you do every day. And EFTAs do this, and they get really good at it, and that's great for everybody. It's great for the patient. It's great for... Absolutely,
and they have a lot more time to sit there and put that extra anatomy in and polish away. You know, I have to go to hygiene or go to, you know...
Totally, or just, you know, go on Dental Nachos and interact with the group. No, just... So I really appreciate you being on with us. I think it's great for us to get our faces out there, for you to tell your job. How could people reach out to you if they wanted to apply for the job or get more information? What's a good way to reach out to you guys?
Well, they could send an email to info@hellertowndentalgroup.com.
info@hellertowndentalgroup.com. I'll put that in the comments. And you have someone that does the interviewing. Should they ask for someone there?
Sean Hashi, or send her the email. Would be
perfect. Sean, ask for Sean. And the website is hellertowndentalgroup.com.
Correct.
So Dental Nacho Group, I think Dr. Ann would be awesome to work for. Met her in person. We're going to go to other courses. We met face-to-face. Get yourself out there face-to-face. Reach out to her for her job. Thanks for being on with us, Dr. Ann. Really had a lot of fun meeting you. And you got to come back to Philly and come to an event sometime soon when you don't have any conflicts.
I will.
All right. Awesome, guys. Have a good rest of the day.
See you. Bye-bye.
Bye.